Welcome to our presentation on statistical versus clinical significance. Today, we will explore the crucial differences between these concepts and their impact on informed decision-making in research and clinical practice. In this introduction, we will outline the key differences between statistical and clinical significance. Our focus will be on their implications in both research and clinical settings, providing a foundation for understanding their roles in decision-making. Let's begin with definitions. Understanding the terminology is essential for grasping the nuances of statistical and clinical significance. This section will set the stage for deeper exploration into these concepts. Statistical significance indicates that an observed effect is unlikely to have occurred by chance. Key concepts include p-values, alpha levels, confidence intervals, and effect sizes. These tools help determine the reliability of research findings. Clinical significance or practical significance assesses whether an effect is meaningful in real-world practice. It focuses on patient outcomes and includes concepts like the minimal, clinically important difference and reliable change index. Here, we compare statistical and clinical significance side by side. Statistical significance focuses on probability, while clinical significance emphasizes practical importance. Understanding both is crucial for comprehensive analysis. Now, let's explore applications. Understanding how statistical and clinical significance apply in various contexts helps in making informed decisions. This section will highlight their relevance in different scenarios. In research, statistical significance helps identify true effects, but it doesn't always equate to clinical importance. Researchers must assess both to ensure findings are relevant and actionable, especially in fields like medicine and public health. The distinction between statistical and clinical significance impacts decision-making in healthcare and policy. Misinterpretation can lead to ineffective practices, highlighting the need to evaluate clinical relevance alongside statistical metrics. For effective research reporting, include both statistical and clinical findings. Discuss real-world impacts and note trends even if not statistically significant. This approach ensures comprehensive and meaningful research communication. In conclusion, understanding the differences between statistical and clinical significance is essential for accurate research interpretation. Both concepts guide clinical decisions and ensure healthcare practices are grounded in meaningful outcomes. Thank you for your attention. We hope this presentation has enhanced your understanding of statistical and clinical significance. Please subscribe to our channel for more insightful content.